Thank you and good afternoon. This is Sam Vaughn for Sam's Sports Report and Sam's Mental Health Day. Today we're going to start with sports for a little quick second, and then we'll go on to Schizoaffective. For more on college basketball, visit this link. The Tigers controlled the game throughout. The Tigers went 10 for 11 on threes and made the most threes they've made in a half. So the Tigers are looking like the Globetrotters. Bang, 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 and a bang. 11 threes, the most they've made in a first half. The problem from LSU wasn't their effort. It was that Mizzou was more talented, and although LSU tried to get close, it stayed throughout Tigers' control. Final was 87-77. I had them 85-75. Also, number 2, Tennessee is upset by Florida. That should be a good tournament bid for the Gators, and maybe they'll squeeze back in the top 25 this week. And if the Tigers get it done on Saturday against Mississippi State, you'd have to think they'd slide themselves into the top 25. We'll talk more about college basketball on Friday. Let's move on to Bipolar. The lady's going to get very specific at the end. You can watch her, but I'm going to have a different style. There's many ways to peel banana, but I'm going to show you the way I would peel banana. Hypothetically, of course, my style. I'm going to talk about my experience. The first thing you need to find is a psychiatrist, or some people like a pediatrician, but to me, it's like a car guy. You want the car guy to fix your car, or you want the tool man to fix your car. Both might work, but I go with the car guy first. First, you should do a swab into your mouth and tell you what medications you work with. Today we will take a mood medication. Kind of like when you have ADHD, you have to get it on a side. You have to get on attention more on about the swab. Just the general things you need to know is they will take a swab out of your mouth, and they will tell you what medications can work well, and the medication that could or could not work, and the most importantly, the things that you're allergic to. The ones that could and could not work are not confined into a quiet science. The one that is confined into quiet science is the ones that you're allergic to. For more on this, please visit this website. Next, you may want to ask yourself how you will have to explain this to a psychiatrist in 20 minutes. Well, a good way is to make notes. It also may be helpful for you to go through a psychologist or psychiatrist to help you gather your thoughts for the psychiatrist that you get an hour to spend with. For the psychologist, you don't get an hour to spend with the psychiatrist. It's very short. It's 20 minutes. And whatever else you need to get help with. Now I'm going to narrow it down to mental health disorder. How do you get diagnosed? First of all, yes, there's those Rorschach test, which is where you look at a picture in a bat and maybe you're supposed to tell them what the hell they are supposed to be, but I can't do that. So I eventually just had the psychiatrist analyze me, and through the assessment that he was able to give, you don't need an actual book, but he can diagnose you through the assessments he's given, and it seems to have been pretty effective. First, before we go through schizoaffective, we're going to focus on bipolar, because it's the only way you can tell what schizoaffective is. When you're going through the meds at the first time, you may not hit the right regimen. In fact, you probably won't. Hitting the right regimen will take time. It's a long road to hit the right medication. It could be months. It could take years. But there will be an eventual point to hopefully that you can take meds. So for that, it will help a person to be encouraged by having a psychologist and encouraging them to take the meds, or you to take the meds. Some of these drugs are called anticonvulsant, which are used to treat seizure disorder, including carbamazepine, lamotrigine, and
carbamazepine,
and lamotrigine and Viperin and acid. Not all these drugs are the same effects. Some of them, such as lithium, are being treated to treat mania, or such as lamotrigine, are maybe treated to use depression. Keep in mind that the mood stabilizers can be misleading if you take time. Bipolar disorder is where you will need a mood stabilizer. This can be used as a secondary mood medication. Can be like that helps your cycles. It could be like Caplyta. It's like the middle reliever, or two meds, or the sister and brother that you need to combination for schizoaffective for bipolar to work. Now we're going to move on to schizoaffective disorder and what kind of meds you will need. Complicated disorder. Luckily, only 0.8% of people or 1% of people have this disorder. Well, the only problem is I'm one of those people. Schizoaffective bipolar type. First, we're going to go through the definition. I know we've gone through it a lot of times, but it's also important to understand the disability so that we can understand. The psychotic mood symptoms occur at a different time. Psychotic disorder is diagnosed in fewer than schizophrenia. Approximately 1% of people worldwide will be diagnosed with schizophrenia. Approximately 0.3% are diagnosed with schizoaffective. Because the prevalence of the disorder is low, because it includes both mood and psychotic features. I've heard a bunch of different percentages. None of them go above 1%. This disorder can be quite difficult. As mood, you're trying to control a mood. In a psychotic disorder, usually you have to take a good amount of meds. 9 to 10 isn't uncommon.
So, like many people who are mentally ill, I take a lot of medications. My medications are the reason that I can live a productive, happy, and independent life, and I'll forever be grateful for that. In this video, I'm going to be talking about the specific medications that I take to help manage my mental illness. And if you don't know already, my name is Kit, and I have schizoaffective disorder, which is a condition where someone experiences symptoms of schizophrenia, such as delusions and hallucinations, but also symptoms of a mood disorder, either bipolar or major depression. And if you're wondering, I have the bipolar type of the condition. And for the purposes of this video, I'm just going to be covering the medications I take for my psychiatric treatment, not other health issues. And so let's get started on me telling you all the medications I take for my schizoaffective disorder. To start off, I'll go back to the very first psychiatric drug I ever took, and that was Lamictal, or lamotrigine as it's also commonly called. Lamotrigine is an anticonvulsant that's actually also used to treat epilepsy. And for me, I'm prescribed it as a mood stabilizer, so it helps me with my bipolar depression. I've been on it for 9 years now, and it seriously changed my life, and it's amazing. Like, it works so well. The next one is Zyprexa, or it's also called olanzapine, and you can pry it out of my cold, dead hands. It's one of the most powerful antipsychotics in existence. And even though Zyprexa is an antipsychotic medication, it actually treats my mood side better than it treats my psychotic side. And I was actually put on Zyprexa because I had delusional thinking and was hallucinating constantly. But when it actually kicked in, the effects on my moods were better than that of Lamictal and lithium combined. And I've been on it for around 4 years now. I did take a break briefly last year when I tried to switch to a different medication, but nothing worked as good as Zyprexa, so I just went back on Zyprexa, and hopefully I'll be taking it until I die. And the next drug is good, old, reliable lithium. Lithium really gets a bad rap, but it's honestly an amazing drug. And the thing is, lithium actually, yes, it treats mania, and that's what a lot of people know it for. Heck, that's what the FDA approved it for. But it's actually really effective at treating bipolar depression, and that's the original reason I went on it. Unfortunately, I wasn't able to tolerate the side effects as well over time, and so I ended up negotiating with my doctor to take a lower dose, and that lower dose does have neuroprotective effects, like dendrites in my neurons are regrowing in my brain while I take it, which is pretty cool. And it also has a lower risk of me unaliving myself, which is also great. So that's why I take it, but I take it at a really low dose. The next drug I take is Zofran, but you also might know it as ondansetron. It's actually an anti-nausea drug that's used to treat a wide variety of things. For example, they give it to chemotherapy patients before they, well, undergo chemotherapy. But I take it to treat my OCD. Who would have thought that an anti-nausea drug could be used to treat OCD? And Zofran actually really helps me deal with my anxiety as well, because one of the things that happens when I get really anxious is I do throw up. And sometimes if I have like a really stressful thing that I have to do at work, I'll just wake up nauseous and the first thing I'll do is go to the toilet. However, if I take ondansetron, the nausea goes away. And so that's really for me where the true value of it lies. And like, yes, it does treat OCD and it does help that, but I'm more in it for the anti-nausea effects.